So we have the huge pleasure to have with us Dr. Joe Loizo. He is a contemplative psychotherapist. He is an author with more than 4 decades of experience in the integration of the different knowledge, the Indo-Tibetan mind science and healing arts, modern psychology, psychotherapy. He is the founder of the Nalanda Institute for Contemplative Science, and he is also a professor of psychiatry at Neil Cornell Medical College, and he is also a clinician in a private practice in Manhattan, New York. We also have with us Dr. Pilar Jennings. She is a psychoanalyst. She is an author and also faculty member in the Psychiatry and Religion program at the Union Theological Seminary of Columbia University and the Columbia Center for the Study of Science and Religion. She has dedicated more than 30 years to studying and integrating Tibetan Buddhism with psychoanalytic psychotherapy. We also have the honor of having with us Dr. Javier Garcia Campayo. He has been a pioneer in the mindfulness field in Spain, also in the academic level, through his research and programs on the benefits of mindfulness in our daily life. Dr. Campayo has made research stays at the Universities of Manchester and Cambridge, and he is the director of the Master of Mindfulness at the University of Zaragoza, which is one of the oldest universities, and he has written more than 20 books. So let's welcome our panelists, and I want to especially thank them for being here with us. Thank you for your time. We are presenting this book that has been recently published. It is an edition by Dr. Loizo with the participation of many authors. It has been edited by Mr. Loizo, Miles Neal and Emily Wolfe. And there are also parts written by Tara Brach, Christine Breller, Mariana Caplan, Diana Fosha, Paul Fulton, Christopher Germer, Roshi John Halifax, Rick Hanson, Pilar Jennings, Concha Pinos-Rey, Jeffrey Rabin, Sharon Salzberg, Daniel Siegel and Robert Thurman. It is an impressive collection, a very comprehensive one, and in this hour, of course, we won't be able to cover all these very deep and important subjects, but I want to thank you for being here with us. So this will be published also on our YouTube channel, and I will now give the floor to Dr. Garcia Campayo. Good evening, Doctor. Good evening. It's my pleasure being with you here, sharing some ideas on these ideas on contemplative psychotherapies. I'm going to be really brief because here the protagonists are Mr. Loizo and Mrs. Jennings. But before, I would like to highlight 2 things. First, the importance of psychotherapy and the contemplative sciences. When the mindfulness appeared at the end of the 70s, this was considered as the first wave of this Western or Eastern movements into Europe. So that was really important, and this was really transcendent in the 20th century. It is said that in 2005 we had a second wave with the upcoming of the compassion field, and it is said also that around 2015 there is so the upcoming of the contemplative sciences in the neurosciences. Wallace was the first to talk about that in his book Contemplative Sciences, and also Rick Davidson at the University of Wisconsin, he described the concept of contemplative neuroscience. So contemplative sciences would be like the next frontier. I think this is really a step beyond mindfulness. It's like the marriage between spiritual traditions and mindfulness, so that we can convey all the benefits of those sciences to the population. I think that this will be one of the main highlights in this 21st century. So we see that contemplative sciences is really important. So they're really important. And so this book is absolutely needed because we don't have that many studies, not just in English, but also in Spanish. In Spanish, we can't find any good material on that. As Enrique has said, these two authors are so important. They are truly a reference in this area. So I truly recommend you to buy this book because it's going to become, it is already, a reference book. And anyone interested in this field should have it, should consult it. And as Enrique said, in 1 hour time, we won't be able to go in depth with all the subjects of this book. I just want to say that I'm really delighted to be here, and I want to express my admiration for these two authors, and I insist this book is indeed very important, as contemplative sciences are. Enrique is muted. Enrique, ¿estás muteado? Can you please tell him? Yes, thank you.
Enrique, can you hear me? You're muted. I can't hear you.
Oh, yes, thank you. That's the mantra, right? You're on mute. Yes, so it's such a great pleasure to have you here with us. And thank you, Javier, for this excellent introduction. And I want
now to remind you that if you want to listen our discussion in Spanish, you should choose the Spanish language.
At the beginning of your book, you talk about how something, I mean, your book was published before the pandemic. And in Spanish, it was published during the pandemic. So it's very remarkable because what we are seeing in Spain right now, and also what I hear globally, is an increasing demand for psychotherapy services globally. Everybody clinicians have their practices filled all over the place, and they cannot supply as much as they would like to attend to the enormous requests. So I was very just touched. In your book, you talk about how this moment is like a manifesto or of standing up to change the world that we created, to deal with the destructiveness and that we have created as a society, and how this is such a crucial time to empower ourselves as clinicians to help our people, our societies, and now the world globally. So I want to just give you the word with this because it's very, very moving. Would you like to say something about what's your experience right now?
Absolutely. Thank you so much, Enrique, for taking on the translation of this book in the middle of the pandemic and for bringing it to fruition. We're deeply grateful to you and to Javier for all of his support, encouragement, and collaboration over the years. And, we do feel that, this is a time when not only is mental health more at risk, that stress levels have never been so great, uncertainty, disconnection, many of the things that we know promote and accelerate mental suffering. And at the same time, there have been many exciting trends happening over the last years, as Javier alluded to, where we as mental health clinicians have been getting access to a whole set of new tools that may really have a tremendous impact on our ability to help people transform more deeply, to accelerate their healing, and also to impact public health in ways that it's hard for us as one person at a time, individual therapists, to do. So one of the things about, there's many exciting things about the convergence that gives rise to this book that can make us hopeful, even in a very difficult time such as we're facing. One is that the new research on how meditation works to promote neuroplasticity, to help us transform and relearn, to rewire our brains and nervous systems, has come together with this greater access to traditional practices, to create a real watershed, a real powerful confluence that, of all the different aspects, all the different traditions or disciplines within Western science and practice, psychotherapy has been the one that's been the most receptive. And so I think that I'll try to explain some of my take on why psychotherapy is ideally placed and ideally structured as a discipline to take advantage of the new science of transformation that's really only recently kind of come about because of the convergence of, understanding the brain and how transformable it is, together with understanding how powerful meditative practices like mindfulness, compassion training, and other kinds of what we call embodied practices help accelerate growth and transformation. So maybe the first thing to say is, we as therapists, kind of practice a very unusual discipline in Western science or Western medicine or healthcare. Unlike most of our peers who may be practicing based on taking lab tests or, doing interventions, surgical or other kinds of radiological interventions, we use this sort of human relationship as a medium for gaining information about a person's suffering and for intervening in a meaningful way. And of course, a big part of that is our own mind and our own ability to understand our own mind, our own heart, and to access a way of being or qualities of insight and compassion that our clients can find helpful. What's very interesting is that the Buddhist psychological tradition that this new movement toward contemplative psychotherapy draws on has for thousands of years been dedicated to an approach to the betterment of human life that's very resonant with the approach of psychotherapy. In particular, like Freud and other of his followers, the Buddha taught that the mind has its own causality, right? That the mind has to be understood as a causally effective, powerful force of nature and can't be reduced entirely to brain or matter or anything mechanical. Also, the Buddha taught that he gave a very kind of similar or a naturalistic understanding of how our minds are formed, that they're formed through eons of evolution or natural transformation of life forms. Even though he didn't know about Darwin, he did believe that there was that we came from other life that slowly evolved and transformed over time. And also that evolutionary past collides with the personal relationships that we have with our parents as children, or as infants and young children, to make us who we are. So that sort of basic outlook that we are a combination of nature and nurture, and that the early relationships really are key to our being formed. Even the Oedipal theory itself is something that the Buddha also taught, surprisingly enough. And finally, based on this shared understanding that the mind really matters, that we are products of nature and nurture, the method of the Buddhist approach, fundamentally healing, right? Fundamentally, the Buddhist teaching is about healing suffering. It's about understanding suffering so that we can bring relief, freedom, happiness that's lasting. The main intervention is a relationship between a teacher and a student. And it's a relationship that's understood as a kind of better parenting, as a reparenting relationship. So there's these many, oddly, or surprisingly, some very powerful fundamental agreements in the Buddhist psychology that really support and validate, from a very different culture and a very different time, many of the aspects that are so important to psychotherapy. And I think is part of the reason why therapists around the world, and especially in the West, have been so excited to learn about this new approach to the mind and to try to integrate some of the powerful methods of meditation that take the play that help us expand on the tools of the ordinary tools or conventional tools of Western psychotherapy.
Yes. Very, very good. And I just did I interrupt you?
That's okay, no worries.
Yeah, have a sip. Yeah. Maybe we'd like to elaborate together with Pilar. How do you weave the Buddhist psychology with the psychotherapy practice? How do they weave and create the construct of contemplative psychotherapy? Could you
Pilar?
talk about it?
Sure. Hello, everyone. Good to
Hello,
be with
Pilar.
you.
Welcome.
Yes, and thank you for this opportunity to gather. This question, it understandably arises quite a lot because, of course, there's many ways to weave these incredibly rich, ornate traditions together as there are Buddhist clinicians. And of course, as we practice, we keep discovering new ways to build bridges between the traditions. And I would say, for me, the way I'm bringing a contemplative perspective and my own Dharma practice into clinical work really does depend on the person that I'm working with, their particular needs, and then also what's getting co-created between us, right? What I would say is a through line is the heartfelt sense that I have now of all of my patients having Buddha nature and appealing to their Buddha nature as really a touchstone in the treatment, so that it's less about my clinical capacity to decode and offer them what they're needing, and it's more about a collaborative joint effort that is guided by their own wisdom, conscious or not. And I think that's one of the primary blessings of a Buddhist perspective in clinical work, is to be determined to appeal to the capacity, right? This deepest layer of insight and wisdom in the patient. And then slowly, because as we all know, this can take time, lots of patience, to lift to awareness, to lift to consciousness for the patient, the capacities that have always been there, but are more camouflaged, often by identification with a traumatized, as Joe says, a traumatized sense of self, or the developmental thwarting that's brought them into treatment. So for me, that really is it's a central theme in how I bridge these traditions. I would just add to that the quality of listening, right? That is so bolstered, so nurtured by contemplative practice. And of course, most clinical training programs will encourage candidates to listen to their patients carefully, with respect, right, with an enormous amount of patience, but that natural capacity is not always there, right? Sometimes we're fixated on our theories of choice, or clinicians are anxious about being able to help the patient sufficiently, and they can get a little bit distracted by an agenda, whether they wish to have an agenda or not. And so the capacity to really slow down and listen with an open heart and an open mind, while of course putting on one's thinking cap and reflecting carefully about the specificity of what each patient presents. It's another through line for me and how I bring these traditions together.
Beautiful, Pilar. And I'm very touched by the clarity that you bring into this discussion. How mindful you also share with us how you keep your patients in your mind and heart. And when you speak about Buddha nature for the people who are maybe listening to this recording, you mean their essence, right? Their core self? Could we just say that?
Yeah.
Or, for people who are non-Buddhist or they don't know the
Sure.
Buddha, yeah.
Yeah, sure. And of course, I wouldn't articulate it in that way in the session with the patient, but yes.
But keeping your awareness of it.
Yeah, that we all have this extraordinary layer of awareness, insight, clarity as we explore in the Dharma. It's just that gets so camouflaged so easily, especially when there's complex trauma. So that's really what I'm appealing to in my patients.
Very beautiful. Thank you so much. And to follow on the thread, Joe and Pilar, you also discuss in the book about attachment and attachment, right? The debate on how attachment is, we are now in an explosion of awareness about attachment therapy, attachment psychotherapy, how primary bonds shape our nervous system. And also the Buddhist or the contemplative say, okay, detach, don't attach, or the yoga, but how these are misinterpreted, right? Could you elaborate a bit? Because I think this is a debate you touch in the book as well.
Yeah. Before I respond to that terrific and rich question, I want to just also respond a little bit to Pilar's comment and say,
thank you.
This understanding of our transformability, of our natural capacity to heal, is fundamental to the Buddhist approach. It's very optimistic. And contemplative psychotherapy draws on this sense that people have this enormous capacity to heal and transform, that not all psychotherapies are as keyed into. And one of the very important things that makes that fundamental to the whole approach that we're offering in contemplative psychotherapy is that we offer our patients tools, practices that they themselves can use to help access and intensify their own healing capacity, right? So that's a whole other dimension to how this approach is different, is that it's not just assuming more capacity for healing, it's also feeding that capacity and helping the patient become a more active partner, as Pilar was saying, in the transformation process. And that's where all of these techniques like mindfulness and compassion and embodied techniques can really accelerate transformation, and also can have this large public health impact of sort of increasing our capacity as clinicians to make an impact. In any case, I think the sort of the language puzzle that you raised, Enrique, is a really important one. Attachment in Western psychology is seen as a very healthy, very good thing. It's really understood as the foundation for human development. Attachment is often one of the words used to translate the word raga in Sanskrit, the word for, there are a number of other words, Trishna and others, that are words that are not positive. And they're words about things that that may actually harm or poison the mind. So it can be very confusing because you have one, in certain translations, in many translations, the whole idea of what I translate as clinging, as fearful clinging, right? It's more like an unhealthy attachment or insecure or disorganized attachment, that it's often translated as attachment, desire, attachment, and in fact, really the whole Buddhist approach is very much to just try to separate within attachment. We know, as Western psychologists, theorists have been following attachment theory, that love and affection, positive social emotions, are mixed with fear and clinging. This is the normal way. Like, love is also a survival instinct for us as social animals. And so it comes out when we come out of the womb. One side of it is the love and the other side of it is the fear and clinging. And in a way, you could think of the Buddhist approach to this complex experience is to try to get more of the positive, more of the love and less of the fear and clinging. And so that they're really saying is it's the love part that really of attachment that is really nurturing and beneficial, whereas this other part that has to do with what happens when we're afraid of abandonment, or we feel abandoned or rejected, the traumatic reactivity that we need to heal and let go of. Pilar, I'm not sure if you have thoughts you want to add to that.
Sure. Yeah, it's such an interesting issue, and an illuminating one, because the Western psychotherapeutic emphasis on attachment to some degree introduces the importance of subjectivity and intersubjectivity to spiritual practitioners, and I would say especially to Dharma teachers who may have been raised in Buddhist cultures that tend to underemphasize the importance of interpersonal attachment. And since it's our origin point developmentally, right, we do come out of this extreme dependency on another, I think it's been so helpful for Dharma communities to just contemplate the importance of cultivating a mature dependency over time without minimizing the importance of feeling intimate and safely dependent on another person. But it is that maturational process, right, with attachment, that's the key. And as therapists, this is something we're exploring all the time with our patients, because if they have not been able to enjoy early, secure attachment, then of course there's usually a tremendous amount of anxiety or despair around the possibility of actually enjoying love rather than fear and clinging. And so the Buddhist understanding of the shadow of attachment can be very helpful, just as a way of supporting people in that maturational development, right? Being willing to risk a healthy attachment, but also to keep investigating, are there infantile needs and longings that are getting mixed in to adult experience of attachment. So
yes, very, very deep and very Very well said. Thank you so much. And to continue with this presentation, and to be a contemplative practitioner, a psychotherapist, it implies embracing the contemplative practices and living them in your own person, right? This is implicit.
And yeah, absolutely. I think, you can't, just as, we encourage therapists, especially in the analytic tradition, to do their own analysis, right? And to really understand their own neurosis or their own blind spots so that they can share that wisdom or that the benefits of that process with their clients. In the same way, a contemplative psychotherapist is encouraged to develop a regular practice of mindfulness, compassion, or kindness, and even a regular practice that sort of helps us be safely embodied and embodied with well-being and care. These are essential in the whole Buddhist approach. In a way, to healing is very much like a wounded healer model. Like the Buddha, learned to be a teacher and a healer. He's considered to be the king of healers, or the mentor of healers, Vaishajya Guru. And he learned that through healing his own suffering. In this case, the suffering of the human condition. Although he did lose his mother at childbirth, so he may have had his own attachment disorders. In any case, that framework is set throughout, that the real source of the added benefit we can share with others is learning to heal ourselves better. And so all of these practices are fundamental. And I say, as someone who, I was the son of a psychiatrist, actually both Pilar and I are the child of analysts and therapists. I personally saw how much stress my father was under as a therapist and psychiatrist. And part of the reason I became interested in trying to take some of the wisdom of the contemplative traditions into practice, into the world of psychotherapy, was to try to help protect our well-being as clinicians, right? To sort of be sure that we're not burning out or we keep growing. And one of the beautiful things about this tradition is it's just a very, very deep, rich, complex method of continuing our healing and growth, even after we get out of our training analysis. And that's really the source for how, whatever more we can do for our clients.
Yes, I love how you expose the transition in your book from establishing the basic tenets of contemplative practice through mindfulness, and then going through the second part where you speak about bringing to the social context through compassion, and all the way how important it is for clinicians and psychotherapists to learn about the neuroscience that comes with all this research around how contemplative practice have an impact on them, on their relationships, and on the world at large. And then you go further to a section that you yourself wrote about embodiment and healing, where you speak about deep transformation. And can you talk about that section that's so connected to your transformation of yourself?
Yes, and I certainly want to hear from Pilar, and you wrote one of the chapters in that section.
So imagery and tantra, yes.
Yes. So one of the unique things about the Buddhist tradition compared to our psychological tradition is it's had thousands of years to grow, and so there's been a development of a lot of different. We think we have a lot of schools of psychotherapy, but imagine if we'd been in psychotherapy for 2,000 years. And usually in the context of Buddhist, later Buddhist culture, the Buddhist culture as it eventually finally became fully mature, around the 10th, 12th, 15th century, there are the three different psychologies and three different methodologies for healing, right? So the mindfulness is the one we're most familiar with. It's what, as Javier said, the first wave, right? It's most accessible, and it allows us to get be able to face our minds and understand their workings, and change the way our minds work. Compassion training is the second wave, and that happened really around the time of the New Testament in Europe. It had started becoming popular in the first and second centuries, and then became really very popular throughout Asia over the next 4 or 5 centuries. What followed was something that you could align with, say, Western mystical traditions, a system of, I guess we would call very deep psychological transformation, which is connected with the understanding of the yogic nervous system. I'm not sure if people are familiar with that. The understanding that we have, that our minds are supported by a central nervous system that has many levels and energies and chemistry, and a very systematic set of practices that are designed to really access and transform the mind and the nervous system at this, what we would normally consider to be unconscious level, a very deep level that probably relates to the processing that's going on in the brainstem and the vertebrate or reptilian brain. So these are practices that kind of are not usually thought of as part of conventional talk therapy. They're similar to things that we know from Jung, for example, or Kohut, for example, has some sort of similar elements. Reich and his body work, or Pearls. Even there's some elements that are similar to Lacan, but these are elements, at least in my view, these are elements that relate to subtle, nuanced inner work that touches on the way the mind in its energy is actually constantly interacting with our nervous system. And so there are basically 4 practices. I think it may be helpful in fleshing this out to just name the 4 practices that are essential to this methodology. One is imagery, where we try to re-envision our ordinary sense of self, our ordinary narrative. The other is narrative and affirmation, where we try to kind of give ourselves a different message, speak differently to ourselves in a different tone of voice. You can think of it as like affirmations or prayer. And those are considered to be top-down practices, right? Our mind is trying to speak to the deeper unconscious mind and give it messages of healing and transformation. The other 2 are working with our breath in very deep, rigorous ways that give us access to shifting the autonomic nervous system. And finally, there's working with our body posture and movement, and this also helps to activate our calming, healing vagal nervous system from the bottom up. So these techniques give you a sense of the very wide range and scope, and this system of bringing all these from the top down and the bottom up, bringing these methods is probably going to be very important to our new understanding about how to work with trauma, right? Because we understand trauma is sort of embodied, is under the radar of narrative and language, and we need to use these creative ways of accessing or messaging. So that's what embodied practices are about. Very exciting and yet very sort of hard to understand, very different.
Thank you so much. This really touched on the ground. And so just to wrap on our discussion today around the book, your book was created from your contemplative science program, is that correct? Can you just talk about your program and how this brought about this confluence that you really put together?
Absolutely. Absolutely. For the last, I guess, 10 years now, we have, Pilar has been as one of our core faculty, and we have a number of faculty, like some of the people that contributed to the volume, Dan Siegel, Rick Hanson, Bob Thurman, Sharon Salzberg, from different disciplines. And the idea of the training, it's now a 2-year training, but you can join either year, mindfulness year or the compassion year. And the idea is that over the course of a year, including some retreats and 30 classes, we slowly gain the foundations, not only in the traditional Buddhist psychology and practice, the contemplative psychology and practice, but also the new neuroscience, new forms of therapeutic application of things like mindfulness and compassion, and a lot of the nuances of how do we actually, as Pilar mentioned, how do we creatively integrate and weave this whole other psychology and methodology into our way of practicing. We're now actually working together on developing a 3rd year that focuses on the embodied approaches, which we now only touch on in the 2nd year. So there's more to come. I don't know, Pilar, if you want to say anything about that, or also, I mean, just embodied approaches in general.
Sure. There's quite a bit to say, but certainly it seems that here in the U.S., there's a surge of interest from patients in having modalities, clinical modalities that are embodied. It seems that increasingly people are seeking out somatic experiencing or sensory motor psychotherapy. And now there's a tremendous amount of interest in also psychedelic assisted therapies to help people access the embodied experience. And as Joe just laid out so well, we have such rich practices in the Buddhist tradition. And one of the practices that I write about a bit in the anthology is the process of working with imagery as a way of getting to that pre-verbal, the very early stages of experience that, as we all know, wield so much power, but are hard to get to in therapy, in part because the beliefs that form during a time that's pre-reflective. So it's when you're in a reflective process with someone, it can really feel like you're going in circles rather than entering into directly what they have lived through. And so the process of working with imagery and visualization that we find in the Tibetan tradition can be enormously helpful. Of course, Freud knew this and wrote prolifically about dreams as the royal road to the unconscious. What I do is just try to help people be more curious about their imaginal associations, right? Sometimes we'll be working with what's arising in the body as we're talking, but I'm also usually encouraging them to just be curious about the images that are also spontaneously arising, and then appealing to those images for a more felt sense of insight about what they're trying to work through in therapy. So it's a rich terrain to work with.
Wow, amazing. So I really want to appreciate your sharing and responding to these humble questions. And I hope this sparks some interest on the clinicians and therapists that follow the publications of this company. And I want to thank Javier because we support one another in bringing this kind of work to the Spanish-speaking society worldwide. And thank you so much Joe and Pilar and Javier for being available to do this online presentation. I will send you the link when it's ready.
Yes, and thank you, as I said, Enrique, for inviting us, but also mostly for taking on the work of this translation, and to Javier for connecting us all, and to our translator, Montse.
Yes.
Thanks very much for your work, and to all of you. Thanks for coming.
Gracias a todos. Buenas noches y os esperamos.
So yes, thank you very much. Good evening, and see you next time. Thank you so much. It was really a pleasure. Thank you all.
Take care.
Bye.
Thanks. Bye-bye.
Bye-bye.
Bye.